Hi guys, so welcome back to my YouTube channel. We'll continue with my discussion of Medical Science Paper 2 of UPSC CSE 2025, Section B. Now, this is the compulsory question, which for me was very tough. Why? Let's get started. Enumerate the advantages and limitations of laparoscopic surgery. This whole segment is a part of our surgery syllabus. But before the examination, what was I focusing on? I was focusing on orthopedics because last year bone tumors का question मेरा गलत हो गया था. So I thought इस बार ortho पे definitely they'll ask a question. There was no orthopedics. Instead, they started, they focused on this more of an obscure topic because this is very generic. Enumerate the advantages as well as limitations of open laparoscopic surgery. Yes, matlab any aspirant can write, but it was this second part jiska I had no idea. All I could remember, and that too is a product of my surgery posting, was there is something known as a Very's needle, which is used to create a closed pneumoperitoneum. So I just mentioned this, then I also searched, but I could not recall it in the examination. There's also an open technique of creating a pneumoperitoneum. So this is 1 or 2 marks, but I'll also consider myself lucky because I remembered this term. So I'll at least score a 1 mark out of 5, and this should give me a 2-3. But this was tough because though it's part of the syllabus, yes, but it is a very obscure thing. Whenever we think of surgery, first the syllabus is humongous. For general surgery, they've in a way asked the two biggest units which are there in surgery along with general surgery topics. So surgery is very tough, and since there's a large segment of unasked questions in surgery, so they're asking more obscure things. So okay, we'll get back to it later what to do, but okay, this was very tough. The first part was tough. Now, anal fissure. If you see the surgery syllabus once again, conditions of anal canal and rectum are part of the syllabus, which makes it a very wide territory. Sky is the limit. So, whenever we think of anal disorders, you think of hemorrhoids, fissures, they're asked, fistula, they're asked, about Good Soul's rule, if I remember correctly. So, okay, anal fissure, some might say it's part of the syllabus, but one day before the examination, moreover in the second shift where you get only 1.5 hours to revise, answering this question in the examination hall is tough. I, of course, had some clinical knowledge because I had seen some cases of anal fissure during my clinical posting. So I remembered that there's a sentinel tag. I drew a diagram somewhat like this. This is the dentate line. Anal fissure is any breach which is below the dentate line, very painful condition. So I was able to partially address the demand. So this first, both the subparts, I maximum expect 8 to 10 marks, which is very poor. This question is both a PSM as well as an OBGYN question, depending on which side of the spectrum you choose it to be from. But definition, something basic. Enumerate the causes. I think the division will be 2 plus 3 or 1 plus 4 in this first subpart. Steps, every PSM program which you know of, you can write. This becomes an easy question. I can score 5 to 6, I believe. Now, pelvic endometriosis. Is it part of the gynae syllabus? क्या इससे पहले पूछा गया है? No, it is not explicitly part of a gynae syllabus. Yes, endometriosis is a very important topic in your final year examination. In general, it's one of the most commonest disorders associated with gynecology. But was it expected? No. How have they asked it? I guess because pelvic pain, chronic pelvic pain is part of the syllabus. But now, since this year they've asked endometriosis, so who knows, next year they might ask anything. Because if you look at pelvic pain, it makes the field wide open. Now, any topic can be asked, which makes the future, not just this paper, but the future papers also very tough to predict. Because now the field is wide open, they can ask anything. For the PSM question, they asked Kilkari initiative with reference to National Rural Health Mission. See, Kilkari is something which during our prelims preparation, we know about this initiative. In Park, if I remember correctly, only 5-6 lines are given. What they have asked is a complete 10 marker. What all you can write, what all you can recall. There are a huge number of programs which the government, endorses, but Kilkari specifically, why they have asked, I don't know. Aimed at, how is it is implemented? Very tough question. Very tough. Maximum 2 to 3 max. I think I'll be able to score. If you look at this first question, out of 50 marks, this subpart 5 marks, even the NL Fisher question, but I'm leaving it aside. But this 10 marker, this 10 marker, nearly 25 to 30 marks is bouncer. And this is in the obligatory question, which will bring down the average for this paper drastically by at least 5 to 10 marks. Mark my words. This time, unlike previous year when people had scored, in 140s, 145, 150, I don't think so anybody will be able to breach. And all thanks to this question, which will bring down the average by 5 to 10 marks, especially this question, because okay, every medico knows what endometriosis is, but we haven't studied about it because we were not expecting this question. And a very haphazard attempt. I'll be happy if I'm able to score 20 plus 20 to 25 in this question itself. Next question was question number 6. This was the question I attempted. So if you look at 3 questions from section A and these 2 questions from section B, so this question was the last question which I attempted. This was expected, preeclampsia. Okay, in obstetrics and gynecology, this was one thing which, with confidence, which I was able to predict in this paper. A 20 marker, but once again, not a full-blown 20 marker. Subparts 5, 10. Classify hypertensive disorders. Okay, preeclampsia, eclampsia, gestational hypertension. Types and complications. इसमें आपको actually mention करना था how eclampsia is timed as per anti, intra and postpartum. And management, you'll give steroids, you'll deliver, you'll give for both symptomatic management, while definitive is delivery. Okay, I'll say an easy question. Now, second question, describe the clinical features and management of ulcerative colitis. Ulcerative colitis, we study about this more in surgery, but this is also a medicine topic. Okay, this is also mentioned in the syllabus, so this 10 marker is done. Now, technically, every medico knows what's the difference between ulcerative colitis and Crohn's disease, but if you look explicitly in the syllabus, this is not part of surgery syllabus. But Crohn's disease is part of malabsorption syndrome. Okay, so this question was asked. Once again, not a very, highly expected questions, but okay, I think I was able to decently tackle this one. And okay, I expect a score of 9 to 10 because this was a good attempt on my part. I forgot to mention a score of 11 to 30 on 14, whatever, in this question. Major objectives of home-based newborn care. State the responsibilities that ASHA is entrusted with to make the program a success. Expected. Why was it expected? Because of UPSC CMS. If you have seen the UPSC CMS paper, for which I'd also appeared in 2022. So this was the most frequently asked question in the second paper of UPSC CMS. So this was also expected, though I was not able to exactly recall the textbook objectives and the textbook responsibilities. So I won't be able, I won't be scoring 9 or 10, but I think I should score a decent 6, 7 in this paper, in this question. So if you look overall, this question went well at 17 and 21. This question, any good candidate can score 27 plus, even I can score 30 plus, but because of the fiasco in the first question, the overall average is down. Now, these 2 questions, though I did not attempt, but let's have a look. Now, in my center, most of the students had attempted this question because of the familiarity with this topic. Even I was contemplating, that I should attempt this question more than the hepatitis question in the first section. But finally, I did not go with it because I wasn't very sure for this topic, Anemia Mukt Bharat. Though, of course, everybody could say that 6 cross 6 cross 6, everybody should know. But okay, I still shied away from it. What is peritonitis? This is also not a very commonly repeated PYQ in surgery. That's why it was asked. They've asked a full 20 marker. Clinical features of peritonitis, management principles can be tackled. Not very easy, but not very tough. This is textbook, very easy. If you look at OBGYN, this year it was a bit easy, except that bouncer of endometriosis, define infertility, investigate the tubal factors, easy. Enumerate the assisted reproductive procedures, okay. Expected lines पे था. This question, if attempted by somebody, if they are quite sure of anemia mukt Bharat and these two, and even a 8 to 10 mark attempt in this portion, coupled with a good 9 in both the other parts, can leave, can have the individual scoring 25 plus. So not very tough, not very easy. Now the eighth question, national framework for malaria elimination, easy. What can be a bit tricky for some individuals is the last subpart, epidemiological surveillance. But if somebody has read TSM's Park textbook very nicely, then this is a cakewalk. Or if somebody has prepared for NEET PG, then this is a very commonly asked MCQ on regarding how we know about the surveillance of malaria over an area. You have to look at the annual survey of the examined slides. You have to look at the infant something. I don't recall currently, but this was easy before the examination. I was able to recall, but once again, since the second subpart, especially this WHO medical eligibility criteria for contraceptive, this 5 marker, I was not sure about this exact WHO medical eligibility criteria. So, I shied away from this question. And cleft palate has been a topic which had not been asked till now. So, this was unasked, which made it predictable. Because if you see in surgery, the syllabus is so vast that they don't feel the need to repeat any common topic, because of which, in a way, since now the unasked topic list, it's a 10-20 topic list still, but that makes it very predictable for the next year. So this question also is a 25 plus question, but once again, I won't say that this is very easy, because if you see this 5 mark subpart, this 5 mark subpart, at least 10 mark out of 50 becomes a bit dicey. So this will bring down the overall score. Okay, so now let's analyze the full paper once again. Okay, this first question, not very easy, not very tough, though pediatrics is a bit typical because the topics are difficult, not very easy. Moreover, in medicine section, there is no psychiatry, which was, somewhat added a sense of familiarity. There is a question on imaging, one can say, but it's very easy to predict an imaging question, but you have to think on your feet, because you can't cram everything up. You can't cram every known disorder and its imaging. So you'll have to use your clinical acumen to answer this question. So in medicine section, very difficult to have an edge. Pediatrics for me is tough because they're asking certain obscure thing. And okay, dermat was easy, but compared to last year, this question of scabies is on the tougher side. Second question was the easiest according to me in the paper, because diabetic ketoacidosis, every final year student knows the management protocol by heart. And the second part also, diarrhea, very common disorder in children, so you're quite aware, though of course this subpart of nutritional management of acute diarrhea is a bit tricky. Eczema, dermat as usual, the saving grace. This question is also a PYQ centric question, so this is an easy question. I'm really sorry I haven't mentioned the score. So whatever I mentioned in my paper, okay, 28 plus, which is quite fair. This third question, I don't know how I'll fare in this question. I seriously don't, because there's very less to write, but it's been disproportionately given a large number of marks. So if they go into the nitty gritty of the protocol, I might tend to lose I might lose some marks, because it's a 25 marker and that also given only 4 pages. This question for me was also very easy. I should score well in this one. Okay, somewhat easy. Leukemia, I left this question, but still this is a somewhat manageable question. But the only takeaway in section is no dermat or very less dermat. We'll get to it later. This question very tough. I don't know why they're asking such questions, because there's no incentive now for medico to take up medical science, because around 25 to 30 marks of the paper is gone in one blow. Okay, so you're actually attempting only 225 to 230 marks of paper, which in general will bring down the average compared to last year. This was very typical because in the name of asking endometriosis, okay, it's part of pelvic pain, but why ask anything under the sun? And if you're asking, then what's the point of making of such an obscure syllabus which opens everything up, especially in gynac, especially in topics like surgery? So the commission must look into it. Okay, this question was the easiest question in this section, for me at least, because preeclampsia, not just in UPSC, but is something which every medico knows by heart for their final year vivas also. It's one of the most important topics in obstetrics, most important condition in obstetrics. So I think this should have been an easier attempt. Coming to the 7th question, okay, they've tried to ask something out of the box. So that, doesn't make it a very easy question. Overall takeaway, this is a tougher paper, at least for me, compared to 2024, especially the second section or section B. Last year, as I mentioned in the starting of the previous video, my score was 137. This year, seeing the overall trend, I'll be happy with the 125 plus. Why? Because of the simple reason that 25 marks ka gone with the wind. In the previous attempt, I had just not known 10 marks ka, that to ortho, because I had skipped bone cancer. But even in that question, the first 5 marks ka I knew. The second 5 was the main issue. Moreover, there was no psychiatry. Dermat ka weightage, they have reduced drastically. This year, if somebody only attempts 2 questions of the first, part A, only 20 marks worth of dermat. I'm not saying ki you ask a 20 marker, but at least a 15 marker in each part should be there, because dermat is very less topic. And still in dermat, if you look, Steven Johnson syndrome has not been asked for the past 3-4 years. I don't know why they keep repeating the same topics this year. See, psoriasis wasn't asked last year, so that was expected. But why stick with only scabies? Why stick with eczema once again when you have so many other things to ask? But thankfully, there was no lichen planus this time, which was being repeated for the past 3-4 years. But I think this deliberately decreasing the weightage of dermat in the first section is in a way lowering the score also, because dermat is the most predictable and the most scoring section of part A, and section B, though lesser is said, the better it is. So takeaways for you, for me, for everyone. First is focus on pediatrics. Why I say so is because after the examination, when I was trying to analyze the paper, everything in pediatrics was from OP Ghai. Now, OP Ghai compared to the other typical textbooks, let's say a Bailey, a Love for surgery, let's say a Harrison for medicine, compared to other standard textbook, Park, Datta, Shaw, is the thinnest, easy to comprehend, and the questions were verbatim picked from it. There was no change whatsoever. Moreover, the reason being that this malnutrition wala topic is something which is also having certain India specific sectors. So that is why my takeaway, which I'll also be implementing in the next 1.5-2 months, which all of you should, is focus on pediatrics. That is the most high yield section. Focus on medicine. Section A over section B. I said this last year also, it doesn't make sense to do complete section B, because section B is filled to the brim, because surgery, a humongous subject, PSM, a humongous subject, and OBGY, also very humongous. Any day, go with the preconceived notion that you will be attempting section A first, and for that you need to have 100% command over pediatrics, over dermat. Medicine is also vast, but it can be predicted. Moreover, medicine is something we study most of the time in a final year, because it takes a lot of time compared to PSM, OBGY, surgery, which are very heavy subjects. So that is the second takeaway, section A. So in short, medicine and dermat along with pediatrics should be prepared for the preconceived notion that 150 marks ka you are attempting section A. This will also help you if any non-bouncers are asked in section A. Because as you see in section B now, especially in these two subjects, even in PSM, the sky is wide open. They can ask anything. The third one and the most important, there is no set pattern. Now this may sound very cliche. Everybody knows why are you mentioning this. Why am I mentioning this? because every year we went in with the preconceived notion now कि there's a question on psychiatry 100%, there'll be a question on let's say dermat ke, there'll be a 15 marker or a 20 marker of dermat which will be very scoring. There is no set pattern. Maybe next year UPSC might not ask a dermat question. How are we so sure? That is why focusing on section A more than that, and focusing this on pediatrics, very low syllabus. It's comparable to dermat but very high yield, because we know the exact source from where they are asking question, which is this textbook 100% compared to other subjects which are very wide. There's no certain single standard textbook for surgery. Some say it's Sebastian, some say it's Bailey and Love. So please, focusing on pediatrics, number one thing, section A more than section B, and there is no set pattern. So thank you for watching, everyone. If you've given the mains this year, please in the comment section tell me what is your predictor score, and I'll see you in the next video.